Steve, this is first rib here, and this video is to show you my thoughts on that research project on mobilizing the first rib. And first rib has a very generous articulation with the transverse process of T1, and it seems to be perhaps more so than other segments. And the amount of connective tissue, of course, I think is much more dense than any other of the ribs. The technique that I like to use for mobilizing it is to come pinch someone on the thickest part of their trap, and if I can feel my thumb and finger through that soft tissue mass, then I palpate inferior to that, and quite often I am then right on that tubercle of the first rib. So I like to capture that, and the plane of the articulation with the transverse process is at about a 45-degree angle. So I would like to lift that forward to fully gap the rib, because that'll cure a litany of sins. First rib, in my opinion, does 7 different things, restrictions, and that this technique is helpful to a large number of those. So what I do is I come underneath and capture that with 2 fingers, and I gap it anteriorly and to the right at about a 30 to 45 degree angle. Then I want to capture the front of that rib and get distraction, and so I do that by engaging the acromion in order to pull the clavicle medially, and my belief is that the SC joint is very strong articulation, and so you end up pulling on the first rib as it articulates to the medial clavicle, and that's that. That's the technique that I would propose. So I end up gapping the rib anterior and a little bit laterally, and then coming over and scooping the acromion and distracting it perpendicular to that force. So that's that. Another topic that interests me is one of posterior glide fixation of the sacrum, which wedges the whole pelvis, and every single spring test throughout is very, very rigid. Same at L5, same at T3, T4 and the third rib, and same at the OA junction. And then one other project that I think would be really nice and quick and easy to do, and I hope to do very soon, is the problem of an AP X-ray of the pelvis as a measurement tool for vertical asymmetry of the pubic joint. And the plane of the film is not perpendicular to the joint. If it was perpendicular to the joint, it would have to be angled at a 30 to 45 degree angle. And I think it's nothing to just place a protractor on the pubic bone and measure that angle and do it properly. But anyway, this is a pelvic model, and I caulked a piece of steel tubing on both sides, and did kind of a rough trial. And if we shoot just looking at it from this position, you can measure the asymmetries. And then if you shoot it purely perpendicular, there is a difference in that. And part of that has to do with the fact that there's quite a width, up to 3/8 of an inch of the AP dimension of each pubic bone. And I hope that makes sense. This one we could knock out really quickly. So anyway, I'll fire this off to you, and we can be in touch. And I do have a very small clinical practice. It'll take me some time to gather up enough clients for the first study, but we'll be in touch. Thank you.